Are these stroke symptoms or something else? Imagine suddenly feeling weakness on one side, having trouble speaking, or seeing double. It's terrifying, and your first instinct might be that you're having a stroke. But the truth is, many other conditions can cause similar symptoms. Recognizing whether it's a stroke or something else is crucial because quick action can save lives and brain function. A stroke happens when blood flow to the brain is blocked or when a blood vessel bursts. The key feature is how fast symptoms appear. Usually, symptoms start suddenly and without warning. You might notice facial drooping, weakness or numbness on one side of the body, difficulty speaking or understanding speech, and sudden vision changes like blurred or double vision. Sometimes, there's a sudden severe headache with no clear cause. Loss of balance, dizziness, confusion, and trouble walking are also common signs. Interestingly, most strokes, especially ischemic strokes caused by blood clots, do not cause pain. This can make it harder to realize something serious is happening, so quick recognition is vital. But here's the tricky part. Many other health issues mimic stroke symptoms. For example, seizures can cause weakness or confusion that looks like a stroke. Sometimes, after a seizure, people feel tired or disoriented, which can be mistaken for stroke signs. Migraines with aura are another common mimic. These migraines can cause visual disturbances like flashing lights or blind spots, along with temporary weakness or speech problems. Usually, migraine symptoms resolve within hours. But if someone experiences a different or more severe attack, medical evaluation is essential to rule out stroke. Facial drooping caused by Bell's palsy can look just like a stroke. Bell's affects only the facial muscles, causing weakness or drooping on one side, but it doesn't usually cause arm weakness or speech problems. Still, it's easy to confuse the two, especially if the person feels tingling or numbness in the face. Interestingly, research shows that people with Bell's palsy have a slightly higher risk of having a stroke later on. Low blood sugar or hypoglycemia can also produce stroke-like symptoms. When blood sugar drops too low, it can cause dizziness, slurred speech, weakness, tingling around the mouth, and difficulty moving one side. High blood sugar, especially in diabetes, can cause blurred vision, confusion, and weakness too. These metabolic issues are urgent but reversible with proper treatment, so quick diagnosis is essential. Other conditions that can mimic stroke include brain tumors, multiple sclerosis, infections like sepsis, psychiatric conditions, and severe high blood pressure emergencies. These can cause symptoms similar to stroke but often have different patterns or accompanying signs. For example, a gradual onset of symptoms suggests something other than a typical stroke, which usually begins suddenly. Doctors look at several clues to tell the difference. Stroke symptoms tend to be abrupt, with sudden weakness, speech difficulty, or facial drooping. Stroke mimics often have a more gradual start or additional symptoms like headache, vomiting, or hallucinations. Younger people and women are slightly more likely to experience stroke mimics. Blood pressure patterns also help. Stroke mimics often have lower blood pressure than true strokes. The most important thing to remember is to act fast. If you see someone with facial drooping, arm weakness, or speech trouble, call emergency services immediately. Do not try to diagnose or wait to see if symptoms go away. Rapid medical evaluation can determine if it's a stroke or something else. Emergency responders are trained to assess symptoms quickly and get the person to the hospital for imaging tests like a CT scan or MRI. These tests are crucial to confirm whether a stroke has occurred and to guide treatment. It's also worth noting that experiencing stroke-like symptoms but not having a stroke can be very distressing. Some studies suggest that people who have stroke mimics may experience more psychological trauma afterward than those with confirmed strokes. This highlights the importance of proper medical care and psychological support after any neurological event. In summary, many conditions can look like a stroke, but the stakes are too high to ignore symptoms. Immediate emergency response is the safest choice. Remember, quick action can prevent brain damage and save lives. Always seek professional medical help if you or someone else shows signs of a stroke. Your health and safety depend on it.